Hello, my name is James Brown. I'm the Vice President of Information Technologies here at PMS. And recently I received a question submitted by Emily Rivera. She's a certified medical assistant out at Santa Fe Family Health. And she had asked if PMS could investigate the replacing of NextGen with a newer electronic medical record system, one that was more updated, more user-friendly, and she went on to cite, the value to patient care and how it might make things easier for clinical members. And so I also had a similar question when I joined PMS middle of last year. So I decided to take a look at that and did a lot of research in this area. And I thought, maybe we could improve in this area. What I found is looking at the other products in the market, this NextGen is not that user friendly. And it has, as compared to maybe some of the other solutions in the market. And I also noticed that the way information was presented and used in some of those other applications, the other solution sets, that it was cleaner and was easier to use in some cases, that information required fewer clicks to get to it. So I started looking at cost factors for replacement, and what I found is the cost of replacing NextGen was really significant. And one of the more interesting facts that I noticed was that in order to support some of the other applications, we would have to grow our teams in IT and data analytics and in training, to make those systems operate as well as what we have today with NextGen. So that was a concern. Also to make a huge switch like that would take a lot of resources and time. It would pull all of our focus as an organization into that and away from other critical projects and that are needed to be done here at PMS. So with all that said, I thinking about it, I used to work for an IT director, and he would say, James, don't tell me where all the sand traps are. Tell me how to get to the green. So with that thought in mind, I thought, well, let me turn my attention to see what we can do to improve NextGen. So I met with the NextGen executive team, met with my team, Dr. Gensini, and what I learned was that there was a lot of changes that were coming to NextGen over the next year to two, and that our first step was to upgrade. NextGen's invested or is in the process of investing a lot of money to improve their solution set, to make it more web-enabled and usable by clinicians and billing and others. And so the upgrade that we have started is going to commence, it's already commenced, and it will end here probably around the end of August time frame is when we hope to be done with that. And this new upgrade is going to provide a cleaner user interface. It's going to make it easier to use, more information more easily available. And it's also going to help us with kind of streamlining some of our processes. There's some improvements in things like ordering modules, billing, and those areas in dental to make things move a little bit smoother for people that use it. So we're going to continue on that path. And continue to focus on improving and working with the NextGen team and the internal teams to make this all come together to hopefully improve the experience that you have with NextGen and kind of move us forward into the coming years. So I want to thank Emily again for her question, and I would just ask that everyone out there, if you have questions or recommendations, you can always hit me on Teams or email. And I look forward to hearing from all of you. So thank you.